Professional educators like you must be aware of the potential danger of bloodborne pathogens. These are infectious diseases caused by blood or other body fluids. Children are not immune to bloodborne diseases, so yes, you are in danger of being infected by your students. We all know about the HIV virus, which can lead to acquired immune deficiency or AIDS, but it's not the only bloodborne disease. Hepatitis B or HBV and hepatitis C or HCV are also dangerous, and they infect many more people annually. Hepatitis means inflammation of the liver. Symptoms range from almost none to severe debilitation. This infection can lead to chronic liver disease or liver cancer and death. The only way to detect HBV is by blood test. Fortunately, there is a vaccine available to protect you against getting the hepatitis B virus. If you do become exposed to a bloodborne pathogen, tell your supervisor immediately. You'll receive a vaccine within 24 hours, in addition to confidential medical evaluations, blood tests, treatment, and follow-up counseling. Hepatitis C is on the rise. HBV and HCV have similar symptoms, so a blood test is necessary to tell the difference. Currently, there is no protective vaccine for hepatitis C, which causes many more deaths than hepatitis B each year. HIV attacks the body's immune system, eventually destroying its ability to fight infection. A person may carry the virus and appear to be in normal health for many years. Many persons with HIV infection go on to develop AIDS, but the rate is declining due to new drug treatments. Many persons infected with HIV now live longer, healthier lives. Blood tests also diagnose this bloodborne disease, but so far there's no vaccine and no cure. All bloodborne diseases are transmitted in the same way, through blood and other human materials, such as semen and vaginal secretions. If you can see blood in any body substance, there's a chance a bloodborne pathogen may be there. Your skin is a natural protective barrier against bloodborne pathogens. Pathogens enter your body through open cuts, nicks, skin abrasions, dermatitis and acne, and mucous membranes in the mouth, eyes, and nose. Pathogens also enter your body indirectly. If you touch a surface that's contaminated with blood or other infectious material, and then touch your mouth, eyes, nose, or open cut, you can infect yourself. Some common sharp objects that could pierce, puncture, or cut your skin are scissors, rulers, staple removers, needles, forks, knives, art supplies, sports equipment, shop equipment, fixed and portable playground equipment, and storage receptacles. Make sure these objects are used appropriately. If a student is injured with a sharp object, dispose of it properly, or decontaminate it according to your exposure control plan if it will be reused. Remember, dried bloodborne pathogens survive on environmental surfaces at room temperature for at least a week. To combat infections, your school system identifies jobs that are at risk to exposure. If you have one of these jobs, you'll be trained to avoid contamination. For instance, special education employees may be more likely to be exposed to blood because their students are more vulnerable to injury. Still, everyone in education today must understand the dangers. An exposure control plan created by your employer is always available to you. It identifies who is covered by the OSHA bloodborne pathogen standard, what the potential hazards of each job are, and what steps are taken to reduce the risks. Standard precautions require you to consider every person a potential carrier of a bloodborne pathogen and to treat his or her blood and body fluids accordingly. The best ways to reduce your risk of exposure are with engineering controls, work practice controls, personal protection equipment, and good housekeeping practices. Your school provides physical and mechanical systems to eliminate hazards. These systems may include puncture-resistant, leak-proof containers at sports fields and gymnasiums for towels stained with blood or other potentially infected body fluids. Site-specific procedures for dealing with student injuries, cleanup, and disposal of contaminated material are outlined in your exposure control plan. but in general, custodians are responsible for cleaning up body fluid spills using proper decontamination procedures. Work practice controls reduce exposure to dangerous substances. They include proper hand washing and personal hygiene. If you get infectious material on your hands, the sooner you wash, the greater your chance of staying healthy. Wash carefully and thoroughly with non-abrasive soap. Rinse completely and dry with a clean towel. If infectious material gets in mucous membranes, flush the area with water as soon as possible. Proper washing reduces chances of transferring contaminants to other body parts or to environmental surfaces. If washing isn't possible, such as on a school bus, use an antiseptic hand cleanser or antiseptic towelettes. These are temporary measures only, so still wash your hands with soap and running water as soon as possible. Also, adopt good personal hygiene habits. Don't eat, drink, smoke, apply cosmetics or lip balms, or handle contact lenses if exposure to body fluids is possible. And don't keep food and drinks in refrigerators or freezers or on shelves, cabinets, counters, or bench tops if potentially infectious materials may be present. And when dealing with an injury, minimize blood splashing, spraying, spattering, and the generation of droplets. Personal protective equipment, PPE, includes gloves, gowns, aprons, lab coats, face shields, protective eyewear, masks, mouthpieces, resuscitation bags, and other ventilation devices. What's appropriate for your job depends on the level of risk you're exposed to. PPE is always accessible to you, such as in the custodian's closet or on each hall. All PPE is maintained, replaced, and disposed of by your school. However, PPE can't protect you if it's not used correctly every time it's needed, if it's the wrong item for the job, if it doesn't fit properly, or if it's damaged. If your PPE is penetrated by blood or other infectious material while you're wearing it, remove the item immediately. Dispose of it according to your facility's exposure control plan. Two common types of PPE are respirators and gloves. Mechanical emergency respirators and pocket masks are designed to protect you from a victim's body fluids expelled during resuscitation. Use these devices instead of unprotected mouth-to-mouth resuscitation. You must wear gloves whenever contact with a potentially infectious material is possible. Use heavy-duty utility gloves for housekeeping. Otherwise, single-use disposable gloves are fine. But if you're allergic to materials in disposable gloves, such as latex, use hypoallergenic gloves, glove liners, powderless gloves, or another alternative. See your supervisor about this. Gloves can, however, be torn or punctured, so cover hand cuts or skin abrasions with bandages before school. Replace disposable single-use gloves as soon as possible if contaminated, torn, punctured, or no longer effective. Never reuse them. While both hands are gloved, carefully peel one glove off from the wrist to the fingertips, then hold it in the gloved hand. With the exposed hand, peel the second glove off the same way, tucking the first glove inside the second. Dispose of promptly and never touch the outside of a glove with your bare skin. Lastly, always wash your hands with soap and running water as soon as possible. Good housekeeping is everyone's responsibility. The Exposure Control Plan lists specific methods and schedules for cleaning environmental surfaces possibly contaminated with infectious materials. But here are a few general rules. Clean and decontaminate equipment and working surfaces with an appropriate disinfectant as soon as possible after contact with potentially infectious material. Use a broom and dustpan to pick up broken glass, not your hands, or call a custodian. Put contaminated sharps and other potentially infectious wastes in closable containers labeled biohazard or color-coded leak-proof containers. Handle contaminated laundry as little as possible with minimal agitation. Place items in labeled or color-coded bags or containers without sorting or rinsing them, and use leak-proof bags to transport wet laundry. Regularly inspect and decontaminate bins, pails, cans, and other reusable receptacles likely to be contaminated.